Hi, folks. Welcome to Royal Dreams webinar podcast. We interview people who have completed degrees from the Royal College of Surgeons and who are closely associated with the Royal College. Today, we're going to interview Dr. Vinay Sundar, who has completed his MFDS recently, and he has a lot to share with us. So let's delve into this examination called MFDS. So, Dr. Vinay, can you elaborate what MFDS means?
Hello, sir. First of all, thank you for having me here. It's a great pleasure to be here. And yes, so first of all, MFDS, it stands for the membership of the Faculty of Dental Sciences, Dental Surgery, Royal College of Surgeons. Now, let me start with something which is very simple. For example, all of you must have heard of doctors having FRCS degrees, right? So the FRCS stands for the Fellow of the Royal College of Surgeons. Now you have exams or degrees which are equivalent to the FRCS, which is the FFD RCS, which means the Fellow of the Faculty of Dentistry, Royal College of Surgeons, right? So for the MBBS people, if it's FRCS, for the BDS or dental graduates, if FFD RCS. Now, in order to be a fellow, one of the primary requisite is to become a member, and that's where MFDS comes into place. And MFDS stands for Member of the Faculty of Dental Sciences, Royal College of Surgeons. So the simple intro to know what MFDS is all about. And Royal College of Surgeons is one of the prestigious group of colleges in the European countries, and they have a lot of sister colleges such as Ireland, Glasgow, Edinburgh, and UK, and all that. So if you have a degree from one of these Royal College of Surgeons, it means you have studied something from the higher standards of care. So it has a value which is recognized in most of the European as well as the Gulf countries, especially for your job opportunities. And of course, it gives you a lot of avenues to practice further or to write more exams, making you something really special and a step ahead for the rest of the dentists from the world.
Okay. So I understood that. Basically, I understood that MFDS is an exam for the dentist, which is very similar to MRCS or FRCS for the for the MBBS people.
Absolutely.
Now, so if I have to write MFDS, should I be an MDS, or me as an BDS graduate also can write it?
Not at all. Not at all. The preliminary requisite is you just need to have a BDS, that is a dental degree.
Okay.
And in some colleges, they probably would expect you to have 1 year of experience post your dentistry. That's it. That is, you need not have worked anywhere, but you should have been 1 year old since you finished your dental degree. Apart from this, you don't require to have a PG. But if you have a PG, there's certainly an advantage in with respect to Ireland, because those who have a PG degree are eligible for an exemption from Part 1. All the MBA exams have a Part 1 and Part 2. But if you have a postgraduate degree or you have a specialty training, for example, say someone is working as a tutor in a particular department after BDS for 3 years, and if they have a letter from their HOD stating that they were in my department for 3 years, you're eligible for an exemption from Part 1. This is applicable only for RCSI, which is Royal College of Surgeons Ireland, where you can skip Part 1 and directly go to Part 2. Now, suppose someone has cleared Part 1 from some other college, say Edinburgh, then they can write Part 2 of another college also. All these are usually, appreciated and recognized by each other.
So, if you can summarize the exemptions, one is if you have completed your post graduation, you are exempted from Part 1. Any other exemption that you were?
The exemption, the website says that you need to have a specialty training. They don't say MDS directly. You need to have a specialty training for 3 years. So it could either be working as a faculty, or it could be a postgraduate, or there's one other qualification. This is for MBBS people. If you have an MRCS qualification, they are also eligible for an exemption for Part 1.
Now, if I have to apply for this exam, so I understand this exam might be valuable. It adds on to my CV. Now, how do I go about applying? Do I need just my BDS certificate, or do I need something else apart from this to apply?
Your BDS certificate is more than enough. You need to have a recognized BLS degree also.
Okay.
Which is you could easily get it from any of the websites online.
Okay.
It's a 15-minute. There are exams which are available for just 15 minutes where you can take up the exam until you get full marks, and it's recognized by the Royal College of Surgeons. Absolutely. You need to know what BLS is all about. That's what they say. And the application process is quite simple. However, it's slightly different from each of the colleges, like Edinburgh, Ireland, and England. So most exams have part 1 and part 2 separately, and you need to clear both of them in order to get your MFD.
All right.
This is the exam route. And just one other point, there is something called as a non-exam route where, say you have completed your BDS in 2010, okay? And it's 2020, we're currently 2023, right? So it's been more than 10 years since you've completed your BDS. Then you need to mail to the Royal College of Surgeons for the non-exam route credentials, where you'll have to submit an application, which is again downloadable from the website, and you have to give what all you did for these 10 years, okay? Say you can be clinical practice, it can be a research, it can be anything related, but if it is something which is appreciated by Royal College of Surgeons, then you're also given an MFDS. This is the non-exam route also.
Oh, great.
The preliminary criteria is you need to have 10 years of experience post your BDS.
So 10 years of post BDS experience, you can get a non-exam route. And I have another non-exam route, which I have heard of. I haven't tried it myself, but if you have completed your endo or perio or prosto, one of the specialty Royal College fellowships.
Yes.
So what we understand here is MFDS is a generalist or the undergraduate fellowship from the Royal College. If you go to postgraduate specialization, postgraduate fellowships like endo, perio, prosto, ortho, or OMFS. So if you have these degrees, apparently you can apply for a non-exam route. Okay. And most probably they do give the MFDS. This is what I think MFDS with Edinburgh does this.
Okay. Right. This is something which I haven't heard of. Thanks, sir. I will probably inform my students also, somebody who is preparing for this.
Cool. Okay. So another question that many MDS people ask is, should I do these specialty fellowships like MEndo, MORTH, or MOMFS, or should I do the generalist fellowship, that is the MFDS? So after doing MDS, does it make sense to do MFDS? Of course, if you do BDS, MFDS is like absolute mandatory if you want to go abroad. But after MDS, how will it help you?
Okay. So the answer to this question is, it entirely depends on what you want to do with the MFDS degree. Now, if someone who wants to settle down in the Gulf or maybe a few European countries, if you have the MFD, it gives an extra value. Okay,
right.
Because it's a clear mark indication that you know something from the Royal College of Surgeons and you have a certain amount of knowledge or certain protocols which is followed universally. That's what they think. So you need to satisfy them. So MFD degree is valuable. So that is one is for the job opportunities. Second, endo versus MFD. Now, I personally wanted to write the FFD RCS exam, right? And FFD RCS again is a specialty exam. It's a separate exam for oral surgery, separate exam for medicine, prosto, endo, pedo, and so on.
That is the one from Ireland, right?
From all colleges also have this. It's not just a slight, difference in the degrees name. One is FFD RCS, one is FDS RCS and all. Ultimately, it's a fellow of the faculty of Royal College of Surgeons, whichever department you're from. That is the goal of FFD RCS. Now, in order to be to write that exam FFD RCS, you need to be a standing member of the MFD RCS. So this is the reason why I opted for the MFD exam. Now, if I want, I can still write the MOMS, because since I'm from oral surgery background, I need to write the MOMS exam and get additionally, get an additional degree. The purpose of it is again, like how MFDS gives you an edge or a chance saying that you have learned from the highest standards of care with respect to general dentistry. MOMS says the same for the respective postgraduate degree.
Perfect. So if you are a postgraduate, it makes sense to do the appropriate specialty fellowships like FFD, RCS, or the MEndo or the MOMFS. If you are BDS, definitely go for MFDS, and it can open up a lot of new avenues that you might not even imagine. So, so Dr. Vinay, can you just name 3 avenues? Just name them. What are the 3 benefits of MFDS for someone in India or looking to shift to some of the foreign countries?
Okay. If you're going, MFDS is very valuable with respect to Gulf countries. That's what I've heard most of it. And someone looking for an opportunity, it's like, you see at MFDS, okay, take the candidate.
Right, right. In
Heard
Gulf.
so many stories of such MFDS stories.
True, true.
If you have the MFDS or MFD degrees, take this candidate.
Right,
It gives you an edge over the job opportunities.
right.
But as far as your skills or clinical training is concerned, MFD doesn't have much of a role because it's an exam that just tests your theoretical knowledge. Unlike your FFD, RCS, also, or M Endo, where you have case presentations and all that, right? I don't think they have also skills testing, but maybe they just test your knowledge in depth compared to MFDS and all that.
Right.
So one avenue is it specifically job opportunities.
Okay.
The second is that, like I said, to write the FFD exam, you need to be a standing member. So MFD is mandatory to write the FFD RCS exams, and someone who has an FFD RCS, you are eligible to work in countries like some of the Asian countries like Mauritius, Malaysia, and all that, where you're usually not allowed to practice there.
Oh yeah, that's interesting. Mauritius accepts our
Mauritius and some of those. How I remember is these are these honeymoon destinations, Mauritius and all these people, Maldives exactly. On all these, the surgeons with FFD degrees who go and tie up with these hospitals in these areas, and since they have an FFD degree, they are given an immediate okay. You're welcome to the hospital. You know FFD. And in Malaysia, you are not allowed to have a private practice. But if you have an FFD, you get a job in one of the colleges, and it's supposed to be a good paying job there in Malaysia. If you get a job as a professor in one of those colleges, because they are very strict about not letting foreign people practice in Malaysia. But it's not easy to get a job even as a a teacher or a professor, and FFD RCS makes your job easier.
Also, I've heard that after MFDS, you can get a postgraduate seat in the UK universities more easily. Is that true?
I'm not sure of this. Postgraduate seat, because there is one a particular degree called as M clinical dentistry, where you can do your post graduation in the UK after your BDS. But there's a catch here, which is even though you complete M clinical dentistry from the UK, you still need to clear your ORE in order to practice.
Of course. Whatever, if you
come back to your native country and only practice there.
Of course.
If you continue to practice in UK, either finish ORE and then do your M clinical dentistry, or the other way around, whichever suits you.
So this is what I've heard.
One other point which to be noted is if you're very serious about this, absolutely pursue, you have a bright future, but it's going to take a huge investment.
You're talking about ORE?
And clinical dentistry and ORE put together.
And ORE, yeah. So that will have it as a different
student or someone from the 10th or the 12th standard who wants to go settle in abroad. My humble advice is after your 12th grade, directly go there. Don't do your undergraduation, and then at least with respect to dentistry. I'm not sure how it works for medicine, but dentistry, you don't get the direct license to practice anywhere. If you're clear about abroad,
you don't get a direct license, but there are a lot of routes in which you can go and practice. And I think there are a lot of.
I'm just talking about the top countries: USA, UK, and Australia.
Yeah. It is tough, but I think people who have done BDS don't have to lose hope. They can still do it.
Correct.
So MFDS, we understand, is a pretty important exam now. Can you just briefly tell us on what the pattern of the exam is?
Okay. I wrote the Royal College of Surgeons Ireland examination.
Okay.
So as I mentioned earlier, Ireland, it gives me an eligibility because I had a postgraduate degree to exempt my part 1. So I wrote directly the part 2. So first, let me talk about part 1. I'll always talk about part 1. So part 2 currently it's an online examination only for Ireland. So which means you can sit in your bedroom and write the examination for Ireland. However, for Glasgow and Edinburgh, you have to go to the centers. There are centers in India for the respective colleges. I think one is in Bangalore, one is in Chennai in Savita Dental College. So you need to go to the respective centers and write the examination. Now, don't think it's an easy exam because it's an online exam. It's very strict. They have very good protocols. You have to show around the room, show the table, show underneath the table and all that. So what I'm saying is online exam doesn't reduce the standard of the examination. It's still the same. The online was introduced during the COVID period to, make sure more people write the exam because they are not able to travel and all that. But they are planning to continue. The diets are out until December at least, where Royal College of Surgeons Ireland is planning to have online exams at least till December 2023. Dates have been announced till December 2023. So coming back to the pattern of the examination, 15 OSCEs will be asked, meaning there are going to be 15 stations. There's going to be one picture and going to have follow 4 to 5 sub questions. 4 to 5 sub questions, and the duration of the exam is 1.5 hours. You have to type the examination, so your examination will entirely monitored by an examiner whom you won't be able to see, but you will be able to hear. And this is about part 2. And out of 15 OSCEs, you are supposed to get at least 7 correct, like 50% pass mark. 7 correct in order to clear.
All right, that sounds doable.
It is doable. It requires 3 months of solid practice. Like, you need to get into the groove. You need to be constantly in the mode of those particular subjects and revising. I'm not saying it's impossible, definitely doable, but requires a sincere effort. That's what I'm talking about. More than hard work, it's a sincere effort, an honest effort.
Yeah, I understand. Any exam with the Royal College, you need sincere effort and guided preparation.
Absolutely.
I believe that guidance can convert even an average student into an excellent student on the day of the exam. So where can we find such guidance? Do you run any guidance programs?
Yes. Ever since I cleared my examination, what I felt about the examination was the examination was easy. Like, easy in the sense I had taken some efforts and I had collected a lot of materials to study from. But I just imagine, had there been someone who tells me what to study, where to study, what are the frequently asked questions, are there any previous question banks and all that. If someone could guide me this way, it would have been much better. And that is what prompted me to start an academy called my own academy, the AV's Dental Academy. It's been there for about a year or so. We have been training students to clear the MFDS examinations. Both one-on-one courses are offered, as well as mock exams are offered. So which will be invigilated, corrected, and feedback will be given.
Oh, that's great. That's great. So how many students have cleared this exam after passing out from your training academy?
Out of about 25 students have cleared so far. I have separate WhatsApp study groups so that,
Amazing.
questions are posted there, so that any doubt is asked. I ensure that someone say, for example, 2 people are there in the group. One posts the answer, one student posts the question and the other student posts the answer. My message will be, where is the source? I want a verified source. It's not like this is the answer you couldn't go. You should question the source, because, for example, anatomy is going to remain the same, right? Wherever you go, whether it's going to be UK, US, or Ireland. But however, when it comes to pediatric dentistry or restorative dentistry, the way you approach the patients here and the way you approach the patients there is entirely different. It's just about some difference in the protocols.
Right.
It's the treatment is again the same, but difference with respect to the protocols. So those things matter a lot. So I ensure they get the correct answers as much as possible, and constantly put them in the mood of the examination. And that's how it works. And of course, effort has to be done from their side also, but at least I tell them what to do. That's what matters. I definitely recommend people take up courses, because I'm sure Praveen sir also has courses for M Endo, M Prosto and all that. These courses, why they are mandatory is, first of all the examinations with respect to Royal College of Surgeons are very expensive, very, very expensive. So if you're going to take up the examination, please ensure you clear it in the first attempt. I'm not saying that you shouldn't take the second attempt, but when you're doing it the first time, make sure it's done right. So when these people offer guidances, they tell you at least where to study from, what to study from, which areas to focus on, making your preparatory process much more easier.
Perfect. So by preparation materials and when you talk about preparation materials, what do you expect an MFDS student to study from? I mean, what is the approximate syllabus, or what all do they have to focus on?
Okay. MFD exam is simply about general dentistry. So the topics are, so whatever final year student from India writes, right? The 9 specialties of dentistry. So oral maxillofacial surgery, endodontics, pedo, community dentistry. Community dentistry with respect to Ireland, not the Indian community dentistry, ortho, pedo,
Okay.
There are 9 specialties, right, in dentistry, if I'm not wrong.
Basically everything.
Yeah,
Yeah.
basically everything. And there is one other chapter on ethics, law, and
Hmm.
what I say, like how, basically ethics and law, how
The
you,
chapter in Sogan Peter
approach the
that we never read.
Exactly. They, in fact, almost in every paper, there is one question from ethics and law. They
Okay.
ask, like, what is a Bolem's test? Like, basically, I'll give you a simple example. Quick example is like, they ask questions like, when can a dentist be held responsible for negligence or something like that? So, in order for a dentist to be held negligible, to be held responsible, first, there should be a written consent form saying that he's undergone the treatment. It should be signed by both the patient as well as the dentist, and the patient should be willing for the procedures. These are all small things, right? Which we do not study in detail in India. So
We
these
don't
things
know
have to
them.
be learnt about. So that's what I'm talking about: ethics, law, and all that.
Right. I
That is an
understand.
additional chapter.
Right. Great. So I think that's about it. If any of you guys have any questions, you can post it in the comments. Um, and thank you so much, Vinay. It was
No
very
problem.
enlightening. I learned so much about MFDS exam today, and I encourage everyone to go and give your dreams a shot. I feel all of us have that innate ability to do more than just BDS or MDS. We can go and do an international exam and clear it. And I believe, especially Indians who have so much of talent in them, uh,
Absolutely.
we just lack confidence. And people like Vinay are there who are giving confidence to so many youngsters out there. I really appreciate it when I keep doing your good job.
Thank you
And
so much.
thank you so much for your time today. Do you have any last minute words for our audience today?
Nothing specific, but I usually say this to all my students. I firmly believe this. If I can, anybody can.
Right. Thank you, Vinay. Thank you for your time. It was wonderful talking to you. All the very best. So I'll drop in your contact details in the
Sure,
description.
sir. Sure.
Yeah, so that if someone wants, they can contact you.
Yes, yes.
Okay, thank you. Good night. Bye.
Thanks, sir.